Hi, I'm David Briggs. I'm the nurse manager here of Urgent Care. We've been here since 2015. We're a 24-hour, 7-day-a-week service. We have registered nurses on every shift who are available and trained in critical care areas and available to see you at any time. We cover all of Benalla and the surrounding regions. We also take anybody who comes in, so it doesn't matter where you're from. We will see you, we will triage you as you were in an emergency department. We'll arrange if needed for a nurse to review you and treat you, or a doctor if they're needed. We do not have doctors on site, but we do bring doctors in as required, and they're on call 24 hours a day. And we're also starting to bring in nurse practitioners who will be available to see you free of charge. For those of you who are unsure, an urgent care service doesn't have a doctor on site 24 hours a day as opposed to an emergency department, which always has a doctor in the department. We have doctors on call 24 hours a day. They are a part of our local GP services. They can be brought in to see you if required by the nursing staff. Behind me you'll see the entrance to the Urgent Care Centre itself. We are located on 45 Costa Street at the first entrance before the main hospital. Our doors are open 24 hours a day. However, between the hours of 9 p.m. at night and 6 a.m. in the morning, they do remain locked just for safety and security. If you press the intercom buzzer to the right-hand side of the main doors, the nurse will answer you as soon as possible and let you in to assess you. So when you come into the urgent care itself, you'll either come to the reception area where the nurse will greet you. She will triage you in the triage room here to my right. They'll give you a registration form to fill out with all your personal details. And then they'll either ask you to go into the urgent care or to sit in the waiting room until they can see you. After you've seen the nurses at the registration desk, they'll more often than not bring you in here. This is our triage room. All the equipment in here is just so we can treat you initially better and make sure everything's okay. Once you've been seen in here and triaged by the nurse, they'll either sit you back out in the waiting room or bring you back into the bays in the general area of the urgent care. We're in the resus room here at the urgent care. This is where you might be brought if you have things like chest pain, you have an allergic reaction that's causing you difficulties to breathe, or we just feel that you need to be in an area where you need some more higher acuity treatment and care for you. So don't be put off by the equipment around you, it's all here for your own care. Here we are in the general treatment area of the urgent care. In these 3 bunks, we'll see you, we'll treat you, we'll look at your aches and pains, we'll decide if a doctor needs to see you, and hopefully we can say to you, bye, never see you again, which is one of the favourite things I have about urgent care and emergency departments. Sometimes here at urgent care you may not be able to walk out the door by yourself, and you might have to get an ambulance in for you. If you are, the ambulance will come in through here, we'll hand over to them and they'll take over your care after the care you got here at urgent care. Alright, so when you finish your journey here at urgent care, we'll escort you out the door. We hope we never see you again. It's one of the few places I get to say that. Just remember, we're here for the community. We're open 24 hours a day, 7 days a week. Nurses are always on duty. And remember, we're best care, best person, best place.